Hello everyone, today we're going to talk about facelift. Are you looking for a more beautiful and bright face? Are you getting old and want to look younger? Have you noticed the beauty and brightness of the world's stars? Most of them are done through a plastic surgery called facelift. A facelift or rhytidectomy is a cosmetic surgical procedure to create a younger appearance on your face. During this video, we'll explain to you all about facelift, the reason for resorting to it, and how to do it in addition to expected results and some side effects. Our role today is to answer most of your questions regarding facelift. Today we have Dr. Bae, who is a leading doctor at JK Plastic Surgery. He is going to discuss with us everything about facelift from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello, Dr. Bae, how are you?
Fine, hello.
Hello. So can you introduce yourself to us?
Nice to meet you. I'm Dr. Bae
Hey.
from JK Plastic Surgery Center in Korea. So I'm in charge of the anti-aging procedure for 12 years. I'm doing the anti-aging procedure for women. For example, the woman's genitalia. I hope a lot of the foreigners visit our clinics and with our specialist, and make the young life and body and face.
So would you please tell us the lifting surgery or procedure that you recommended by age groups?
It is important to start the anti-aging process as soon as possible regardless of age. As for the anti-aging process conducted by age group, those in their 20s and 30s implant to maintain their current youth and prevent aging. Therefore, maintaining a younger face through laser, HIFU procedures, Botox, and filler procedures is the most priority rather than surgical methods. For those in their 40s and 50s, they can feel more that aging is progressing. As aging is in progress, laser, HIFU procedures, or thread lifting that make aged skin younger will be performed, or recovery injection that makes aged skin younger will be performed. Also, since the eyes start to droop little by little, surgery related to eye aging can be performed. People in their 60s and 70s are in a state of aging. When a patient visits a hospital to manage aging, we recommend a surgical method rather than a simple procedure. Facelifting or lifting surgery to improve the stretched neck is performed, and brow. Forehead lifting surgery using an endoscope is performed because eyebrows are drooping a lot. For the eyes, upper eyelid and lower eyelid surgery can also be performed. In addition, those who are in their 60s and 70s, the skin itself is completely different from before, when people are that age. So laser treatment or injection therapy is performed to change the skin condition when aging is further advanced.
So is there any golden time for anti-aging procedure or facelifting?
What I always say is the sooner the better. If you start managing your skin earlier, you don't have to undergo the major surgery, and you always maintain a certain level of young appearance. When you feel aging, you come to the hospital to consult your problems with the medical staff, find out which treatment method is most appropriate, and do the most necessary treatment. As aging progresses, you may need a little more or bigger procedure than you think. So it's better to manage it as early as possible before that happens.
So since doctor, you have met patients around the world, so can you tell us the difference between Asian and Western skin type?
There are a lot of differences in the case of skin. European and American skin is very soft. That's why it droops well, and aging begins early. On the other hand, Asians have thicker skin, and these skin types make a significant difference when performing surgery. In addition, Asians and Westerners have a big difference in the skeleton. As the interviewer in front of me now, Westerners' structure is more three-dimensional, with a rounded shaped face. Asians such as Mongolians, Chinese, or other Asians tend to have a square-shaped faces. Since a face is flat, and the left and right sides are square types, dissonance occurs when lifting procedures are performed in the same way for Asians and Westerners. For example, in the case of Asians, the volume of the upper face is relatively large, and the skeleton is large. So surgery by supplementing both volumes of the face does not suit them. On the other hand, since there is no volume on both sides of the face for Westerners, vertical lifting is performed to perform surgery suitable for the shape of their face.
So at what age does non-surgical facelift usually work?
Young people proceed with a non-surgical method or a minimally invasive method. Importantly, soft tissues fiber. If the tissue is too weak, making improvements when performing thread lifting, laser, ultrasound therapy, etc. is very difficult. In addition, when thread lifting is performed, the face surface may become more irregular. Therefore, performing a procedure at a younger age when the skin is more elastic can lead to satisfactory results. However, getting older does not mean that you can't undergo surgery. Those who work too busy cannot undergo the surgery that requires a long recovery period. So in this case, even if the results fall slightly, you can make younger skin than now using a simple method to give you a more youthful feeling. It is good to receive procedures or management when you are young. Still, since it is not surgery because you're sick, it is better to receive maximum treatment according to your social situation, even if the time is late.
So are surgical facelift permanent?
There is nothing permanent actually. However, we tell patients that the surgical lifting procedure is semi-permanent. In fact, the meaning of permanent does not mean that aging has been stopped, but that it is made into a skin state 15 to 20 years ago through surgery and then undergoes the aging process from that state. In other words, when the aging process progresses for a long time and reaches the bottom of the river, we raise the condition of skin back upstream of the river and make it gradually flow down again. Even 10 to 20 years after the operation, if the result of the skin looks 10 to 20 years younger for your age, it can be said that it is a permanent result.
So lastly, do patients have a facelift in their 70s as well, or 80s?
People in their 70s may think that it is dangerous to undergo surgery and that it will be too late, but those in their 70s definitely can have surgery. Usually people in their 70s come to the hospital to live a new life after being financially relaxed after never receiving such care in their lives. But they are worried that they will not be able to undergo surgery because of their age. However, with the development of treatments, anesthesia can be safely anesthetized, depending on the health conditions. For example, there's now a safe sleep anesthesia that allows you to breathe well and prevents you from feeling pain. Sometimes there are people who are worried that something will go wrong while anesthetizing. But since there is a safe anesthesia method, even if the patient's health is poor, a long operation of 10 to 12 hours is possible if the doctor controls it well. The oldest patient I had operated on was an 83-year-old American patient. She was a person who came to the hospital because she wanted to have a surgery after retirement. But after surgery, she went to Southeast Asia and is enjoying a new life.
Also, that's it for facelift procedure.
Today we learned many things about facelift, and the doctor explained in details everything related to this cosmetic surgical procedure. Thank you for joining us today at Doctor Bae TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.